Hello, everyone. Good morning, good evening. Depends on where are you. Ansel, please contact me on the messenger just to tell me if I can start the lecture or I have to wait people to come because I don't have any control on the numbers of participants now. So please just contact me on messenger to tell me I start my lecture or still wait. Okay, I will start. So hello everyone, good morning. I'm very happy to be here with you with Fanta. Fanta is one of my very old friends. We are working together since 2016, 17. Amazing company, to be honest, and they are dedicated to rotary and manual files. And they are pioneers in this field because Fanta, one of the most first companies that have reproduced um, rotary files. So I'm very happy to be with them here in this lecture online, and hopefully we can meet offline, face to face with you from all over the world. And allow me to start my presentation. My presentation today is about bypass to retrieve. So you know that broken instrument is a very big obstacle and a very big problem in our daily practice. Sometimes we are facing broken instruments from others. Sometimes we are facing broken instruments that have been broken by us. So we are breaking the files and we don't know what to do with them. So separated instruments are a very big nightmare that we have to deal with it, either with bypass, retrieve, or maybe surgery sometime. Here I'm posting my Instagram and Facebook account. So if you are interested to see more cases, stories, you can follow me on Instagram and Facebook. I'm more active on Instagram, showing live cases, sharing stories and reels. They are all related to dentistry and endodontics in specific. So, as I told you, that broken instrument is a very big problem and we have to deal with it. But before I start my lecture, I want to show you this case. This case came to my clinic with a retreatment. So I want you here to be active on comments, okay? I want to see your comments. So as you can see, this case came to my clinic for retreatment. How you evaluate this case? Is it easy for retreatment or it's complicated? It's easy, right? So what we have to do is just open access because already we have a very big access. And we have to remove the 𝗕𝗏𝗀𝗀𝗃, then obturate the case with no problem. Oh, but when I was trying to remove the 𝗕𝗏𝗀𝗃, that happened. But what do you think? How this 𝗕𝗏𝗀𝗃 piece could go outside? How? How come? Tell me how that happened. Can you tell me in the comments if you are on the Facebook or on the Zoom link? Just type in comments how this piece of 𝗕𝗏𝗀𝗃 could come out. I want to check the comments on Facebook. Okay. So some of you will tell me that lateral canal, others will tell me that there's a perforation, and I removed it. But from the beginning, the piece wasn't there. It was here on the 𝗕𝗏𝗀𝗃 from outside. Because of that, we have to read the X-ray very carefully and act accordingly. Okay. Broken instrument. What is breaking instruments inside canals? Instrument can be broken by two methods, let's say. We have torsional fatigue and cyclic fatigue, and we know this from universities. Torsional fatigue. Okay, so that was cyclic fatigue. So what is the meaning of cyclic fatigue? Cyclic fatigue that we have used the file many and many times. So the file is fatigued, the file is tired, and will be broken very easily. Okay, the other thing, the other fatigue that we are afraid of is torsional fatigue. So what is the meaning of torsional fatigue? Torsional fatigue can affect new files and old files. So the file tip is sticking inside the canal and the body of the file continuing rotation, and that can break the file easily. So I will ask you another question here. What is more favorable in fracture, cyclic fatigue or torsional fatigue? Yes, cyclic fatigue. Why? Because when the file is broken because of the cyclic fatigue, the file will be in the canal not highly engaged. And this is good, and it's easier to be retreated or easier to be retrieved or bypassed. But when the file is broken by torsional fatigue, that will cause big problems. Why? Because the file will be stuck inside the canal and not easy to be manipulated or not easy to be dealt. Access is one of most important things in our practice. So if you are establishing very good access, the case will be easy. The case will be treated easily. The complications will be less. So such a case have been sent to me by my colleague, asked me just to give her some advices how to do access, and I told her that you can do it care is oriented, be careful, you don't have a very big chamber. And after 30 minutes, she sent me this one. So the tooth was destroyed, and this is not good. Okay, so the tooth from here to here, now the tooth is for extraction. So because of that, we have to establish a very good access, but not like this access. Another case here, manual file broken. If I ask you what is the cause of broken instrument, and if you can notice here that we have two broken instruments, one very long and the other on the coronal part is short. But what is the cause? Torsional fatigue or cyclic fatigue? What do you think? What do you think? Hmm? Maybe the first is cyclic fatigue, the other one is torsional fatigue. Why cyclic fatigue? Because it's a manual file. Beside, we have very bad access. So the access must be established very well. Straight line access to prevent breaking instruments. Another case here, if I ask you how the doctor could break this instrument here, what you will tell me? How? We can see a tooth without access, and the file is broken inside. What is the major cause of the fracture here? How? Okay, not how he broke the file, but how he can insert this file inside the canal without uh, without even accessing the tooth from the caries. on the distal aspect? No. There was an axis, but the axis is very small that cannot be shown on the X-ray. So please, when you are establishing the axis, you have to be careful because you can break even new files with bad access. The other thing here that I want to highlight uh, that when you are doing the access and you want to refine the access, you have to use ultrasonics, but not in this case. In this case, if you want to enhance the access, you have to have very good visual control. Maybe loops. If you don't have loops, fine, but at least good mirror, good illumination, in order to see the axis and to see what you are doing inside. The other thing here I want to highlight too is please do not use H files inside the canals if they are narrow. So H files here, why to use H file? So you are doing patency with H file, and this is not recommended at all. And this is the case after the axis enhancement. So we bypassed and we have treated the case. Broken instruments inside, outside. So we are facing broken instrument is everywhere. Here we have broken instrument. If I ask you why we have a broken instrument here, yes, because of the access through the crown. So we have very minimal access. We have a crown. We have bad access. If you can read the access very well, you can see that inside the chamber, the axis is not straight line axis, and the file has been inserted inside the canal with a very big stress. Okay, and from here, we have to know the morphology and anatomy of our canals. Fortunately, and that a very good thing, that canals, they are not cylindrical, or cylindrical canals, they are the exception. But the rule here that we have C shape, we have we have a trapezoidal, we have ribbon shape, we have oval shape, and according to this study, if you can read, of course, that we have a classification for the morphology. We have type 1, type 2, type 3, and type 4. And they are according to the cross-section, changed or unchanged from the coronal part to apical part. And knowing that can help us a lot, in I think that we have a problem in the connection because Facebook Live have been stopped. I think so. Okay, so, and this is a very good thing to be known. Why? Because the file, when it is broken inside the canal, as you can see here, we still have a space beside to bypass. Okay, so bypassing is all about finding the catch beside the file. So you are finding the catch. You are not creating a catch. Yes, you can create a catch with a rotary file. You can create a catch with ultrasonic, but are you sure that this catch can lead you to the end of the canal? Nobody knows. Maybe you are creating a ledge, then you are creating a false path. So you have to be careful, and ahead I will explain the technique. Okay, so as I told you at the beginning of the presentation, that we can deal with the canals in a lot of ways. One of them is bypass to retrieve. Okay, so we have surgery, we have surgery, we have bypass, we have retrieve, we have leaving the separated instrument. So we have a lot of techniques that can help us to deal with broken instrument. But what if we can combine bypass and retrieve in one technique? So here, as you can see, we have bypassed the broken instrument. Okay. So what is the technique about? The technique is about to start with K file number 10 or K file 8 and try to find the catch. So I found the catch. I started to go inside, to go more apical, more apical. When you are going more apical, you can notice that the file is going inside and the stopper is following the crown. You have to stop and take X-ray. You have to know where are you, because sometimes you are creating a ledge or wrong path and you are following the wrong path. So please keep this in mind and take home message. The bypass must be under the control of apex locator and X-ray. Why apex locator? Because apex locator, when you are doing a wrong path, the apex locator will start to beep and tell you that you are outside the canal. So as you can see here, so I start with K file number 10. And here in the bypass, I do recommend to use K file number 10, length 21 millimeter. So 21 millimeter is better than 25 millimeters. Why? Because of the tactile sensation that we gain. Okay, so keep this in mind. 21 enhancing the tactile sensation and allowing you to feel the tip of the file more than 25 length. Okay, so if the canal is long, after I do the bypass, I shift from 21 to 25. Then I shift to 15, then 20. At 20, I stop. Okay, so after 20, I stop. I don't go bigger. Why? Because I don't want to create a very big space to the file to fill down. And here you can see an illustration, how I'm enlarging the space beside the file. Okay, as I told you here, do not go and enlarge more. And if you want to go with rotary, and now I will tell you how we do that. So we finished with manual, 10, 15, 20. We stop here, we are irrigating, checking patency, everything is okay. And we try not to engage with the file. So please do not insert any ultrasonic inside if you can't see the instrument and you don't have microscope. So this technique is very good when you don't have microscope, when you don't have magnification. This technique is very unique for you. Okay, so you can even retrieve the file without seeing the file. But please, here, do not insert anything at this moment, okay? Then, if you want to go with rotary file, you can go with rotary file. And here I do recommend to use reciprocation files, maybe more than using rotation files. Yes, you can use both. You can use rotation file, rotary files, and you still can use reciprocation files. Why reciprocation files? Because reciprocation files will, you know, at the beginning of this presentation, we brushed on how broken instrument break, or instruments can break. How? Torsional fatigue, cyclic fatigue. When we have a reciprocation movement, the fatigue will be less on the file. But you have to train yourself, because, you know, reciprocation files, they are not so popular, and we don't have many users for reciprocation files. So you have to train yourself how to use them, but it's a very easy thing, nothing complicated here. So R1 mini file, one of the amazing files of Fanta. Fanta has, as I told you, a pioneer company in files manufacturing, and they have maybe more than 6 or 7 different maybe 8 different file types. They have silver files, they have blue files, they have reciprocation files, they have kids files, they have retreatment files, and even normal files. They have many designs like flat side, flight side files. Um, as I told you, silver files, blue files, and golden files. And here we have this R1 mini kit. I've been using this kit. They gave me some samples since October last year, and to be honest, the results are amazing. This file has only three files in the kit. Because of that, it's a mini kit. We have the open file is 1905. Okay, short file 1905. Then we have the white file is 1704, and then we have 2506. In this technique, bypass to retrieve, I do not recommend to go for big files. And if you want to go for big files, do not go for full working length. Okay, because if we do that, we might break another file, or maybe we will enlarge the canal too much, and that will be dangerous. Why? Because we can do a transportation or even strip perforation, or allowing the broken file to slip inside the canal. Because of that, we don't want to create a very big space beside the file. Okay. Okay. The mode of action. The open file is a rotation file. Okay, it's yellow color, yellow ring color, 1905. So you can use it with the rotation, 300 RPM. You can increase it up to 400, and the torque 2 to 3 Newton centimeter, 2.5 recommended by the manufacturer. And then you can shift to the white file is 1704 in reciprocation mode. The clockwise angle is 30. The counterclockwise angle is 150. So please, here, when you are using reciprocation files, you have to be aware of the angles, because you can't use angles only from your mind. Sometimes with rotary files, we can use our own technique and our own expertise in rotation files, like running them in high speed, low speed, increase or decrease reciprocation torque. But here, no, you have to stick to manufacturer recommendation, which is 30 clockwise and 150 counterclockwise. And you have to target the path beside the file. Okay, after that, so you have prepared the canal up to 15. If you want to use something bigger than 15, like 2004, you can go for Fanta other files like blue files, AF blue, or flat side AFF1, and pick up the 2004. Bigger than 2004, I do not recommend. Then you can shift and use the ultrasonic here. Fanta, they have a very nice device called Actor Pro. It's wireless ultrasonic device, Actor Pro. It's a very amazing, and with a very thin tip. The tip size is 2002. So it's like a manual file 2002. And they have another one, 2502. So you can fill the canal with EDTA solution, and then put the tip of the ultrasonic inside and activate it, okay, continuously with in and out motion. But when you are doing out motion, do not go above the broken instrument. So you have to stay within the broken instrument in order to allow the file to go up. And because you have enlarged the space above the file, the broken instrument, so you have bigger space to the file to jump out. Okay, so this way you have to do it continuously under EDTA solution. So the canal has to be wet with EDTA, because EDTA solution can do lubrication effect, and then the file will jump out under good visual control, as I told you, or loops. But if you don't have them, no problem, but you have to be under X-ray control. So when you are inserting the ultrasonic of Actor Pro, you have to take X-ray and see where are you. And when you are pulling the file in and out, please be careful not to go above the broken instrument. Why we are not allowed to go above the broken instruments? Because if you are going above the broken instrument and you are touching to the head of the instrument, there is a risk of file slipping. So the file will slip and go inside, further inside the canal, and you will make the case more complicated. Here you can see the illustration. You see, the file jumped easily. Why? Because I have very good big space above the file, and I have small space under the file. So, and the space beside the file is blocked by what? Is blocked with the ultrasonic tip. So the file has no option to go further, only to go out. Okay. Another case. What you can notice here, yes, but here I catch the file with a micro tweezer. What you have noticed here, that with this technique, you are very conservative. And this is the point of this technique. Yes, someone can ask me, doctor, why not to go with ultrasonic technique from the beginning? Yes, you can go with ultrasonic technique from the beginning, but you will waste your time, and not in all cases you can do that, and not all of us have microscope. The other thing, that it's more invasive technique. Okay, it's more invasive techniques and requires a lot of training. You can see here the case, and you can see the conservativity. I don't have a very big preparation, a very big ledge created, because after removal of broken instrument, we have to deal with the ledge. But here you don't have to. Why? Because you don't have a ledge even, and if the ledge is presenting, it's a very small size. Okay, the ledge is minimal. Another case, 2 broken instruments. We have retrieved the first one, and this is the other one, step by step. So as I told you, when I'm doing the bypass, I have to go inside, and my favorite manual files, they are Fanta. Since the beginning, when Fanta just first time started to produce in the market and introduce their manual files, and I'm a very big fan. And now the good news that Fanta, they have D files, D finders. They are amazing, especially 821. Size 8, 21 millimeter. It's amazing file. It's a very good file. But as I told you, you have to train yourself how to use them. So I'm using K files. In bypass, I do recommend to use K files, not C files. Okay. Yes, we can use Defender, but D files, they are step files. So sometimes they are creating a space, and sometimes they are catching in the wall. So if you are using D files, you have to be very careful. Otherwise, I do recommend to use K files. Okay, new files, we have to have a deal here that K files must be disposable. You are not allowed to use to sterilize K files. So in this case, I finished, I discard all files. Now, with Chinese companies and presenting of and having a lot of brands in the market, files, they are cheap. Okay, they are cheap. We don't have expensive files like 10 years ago. So why not to use the file for only single time or one time only or one patient only, maximum 2 patients, and discard it. So you are not paying a lot for this file. So please do not use files many times to decrease the possibility of instrument breakage. So here I bypassed, I retrieved, and here the obturation. As you can see, the ledge is very minimal. The preparation is very minimal. And this is why I love this technique, and I still use this technique. Okay. If you go back to my slides, I have recommended to use this technique with short files, so between 4-5 millimeters maximum. But here we have a very long file. So here we have to use something, we call it a grasping technique. So we have to do platform, to expose first to 1-2 millimeters of the file, and then grasp the file out. But I have tried this technique. I bypassed, and then I used the ultrasonic. Then with micro tweezer, I could remove it. But what helped me to remove this file, not because only the technique, the other thing, because the file wasn't so engaged inside the canal. Why? If you can notice that the file has been broken with a very clean cut. What that means, it's a cyclic fatigue or torsional fatigue. Yes, it's a cyclic fatigue. So the file was very tired, have been used many times, and have been broken inside the canal without engagement. So that allowed me to retrieve the file with ease. And here is the confit, then obturation, and you can see very minimal preparation. Favorable obturation technique is to use bioceramics and warm vertical. Why? Now we are using warm vertical files, warm vertical compaction and bioceramics, because they are very popular now, and they are giving us the opportunity of 3D obturation. Why to go for this technique? As I told you, less invasive, does not matter which wall you are engaging, because when we are doing broken instrument retrieval, they always recommend us to go for the inner wall. Here doesn't matter where is the file is, where the file is bypassing, we are following inner wall, outer wall. For us, there is no big difference. Ledge formation is less likely. Going for ultrasonic directly may cause secondary fracture, ledges, strip perforations, etc. Some recommendations, because before starting the case, you have to study the case, you have to read the X-ray very well, make decision before. So please, when you are picking up a technique, you have to follow the technique and the tips for this technique. So you don't have to improvise here. So okay, I will retrieve, no, I will bypass, I will do surgery. No, you have to put your tactics and strategies before even start the operation. Start with easy canals. So you have multi-rooted tooth. So start with easy canals. So you have the broken instrument in the mesobuccal canal. Finish the palatal, finish the distobuccal, finish if you have MB1, for example, and then go for the complicated canal. Why? Because when you are doing that, you are more motivated, because you have finished 90% of the case and you only have this problem. So you can focus on it. And in case if you want to bring the patient for another session, when you have finished a lot of work, like finishing other canals, you still have time next time only to focus on this problem. So please, when you are feeling fatigued, tired, please put temporary filling and bring the patient back in another session. This study is very nice one. It's by Prof. Marcus Platz, talking about influence of operator experience, and this is very good. Yes, operator experience can enhance the outcome, and if you think about that, you will find that this is true. Okay, he's talking about bond strength, but I'm taking this study and I'm showing around, talking about the influence of the operator experience. Why? Because experience matters, to be honest. When you have good experience, you can deal with cases with wise thoughts. But when you have less experience, you are always like eager to show yourself, to show your ego, to show that I can. So you start to miss there, here and there. So please take this in consideration. Improve yourself, do more and more cases, refer cases in case you can't treat them. Please do not say, oh, okay, I will do it myself, I can do it, I'm the best. Okay, you are the best, but sometimes we all have limitations, and always referral must be considered as an option. Bypass to retrieve as a conservative approach. Learning curve must be considered, as I told you. So you have to take your time, learning yourself, taking courses, attending lectures. Visual control is very good if you don't have microscope. Okay, Fanta, they have very nice microscope that I love. I love it, to be honest. It's very good one with very good options, and having good armamentarium. So if you have very good armamentarium, you have good files, you have good instruments, you can treat cases better, and more and above that all, you have to have good training. Thank you very much. That was my lecture, and I'm open for any question if you want. I don't know how to take the questions, but that was my lecture. Ansel, I'm with you. I will stop sharing my screen. If you have questions, if you don't have them now, you can send them on my direct. Okay, I was happy here to be with you one more time. See you soon, somewhere around this world, or maybe in the virtual world. Thank you, Fanta, for this invitation. Thank you with being with me from the most morning, and goodbye.